Hi everyone, I'm Dr. Sachin Ambekar, Director Minimal Access Surgery at MASSH. Today I wanted to give you a general information about inguinal hernias. As you all know, inguinal hernias are a defect in the inguinal region in the abdomen. Basically, hernia means an abnormal protrusion of the abdominal organs coming through the skin and showing a protrusion just like a golf ball. But what I'm going to tell you today, the word is rare. Female hernias or female inguinal hernias are just about 2% of the population in the complete lifetime of a female. What I'm trying to say is basically female inguinal hernias are one of the rare entities found in today's medical world. If a patient comes to me that I have a small bulge and which is painful, and over a period of time I've seen the bulge growing, I immediately think that yes, it is something to do with herniation. But then comes the most surprising factor, that she's a female. Again, as I'm reiterating, female hernias are very rare to diagnose and to come across. The symptoms are the same, just as you would find in the male hernias. That is, the hernia presents with a swelling, or rather I would say an abnormal swelling in the inguinal regions, that is just at the girdle regions of your abdomen. And over a period of time, due to laxity of the abdominal muscle wear, a tear, or for example, many patients come with multiple pregnancies who have got a very lax musculature. Sometimes even found in females who are doing a lot of weightlifting. There are heavy weights which are being picked up by the females over a period of time tend to produce this kind of hernia. If I speak statistically, probably the ratio for men to women will be 42:1. So you can judge that 42 patients of hernias in men I will be able to see, rather than just having a patient who's just got a singular effect. That is 42:1. That means a patient is only coming to me once in a lifetime to show me that she's got a hernia. Now, what is next? How do we diagnose it? So in today's modern world, we have an ultrasound to detect the hernia. Apart from the clinical examination, which is the most important tool for detection, your surgeon should have an expertise to recognize the defect and diagnose it clinically that there is an inguinal hernia of the patient, and which needs probably an ultrasound to qualify it and to state it as a radiological diagnosis. What next? Well, you don't have to be scared. The most important thing is these are treatable, and it is done by laparoscopic surgeries or keyhole surgeries, as we do in general laparoscopic inguinal hernia repairs. We do a surgery in which we place a mesh in the defect, reduce the hernia, and the port scars are barely minimum, so you can carry on with your day-to-day daily activities from the next day onwards. Most of my patients get discharged the next day. There are no restrictions of having a bath. Bathing is allowed. You can climb stairs, have a normal diet, and you can even go driving the third or fourth day if you're very comfortable. And I think when we talk about females, it's about scars. So you can wear your bikinis, you can wear your t-shirts, you can do whatever you want. Scar is barely visible, and it's a very treatable entity rather than just leaving it to any kind of other possibilities like alternative medicines which do not exist for hernias. My observation is a lot of people have googled about hernia belts. That's a myth, that's a fallacy. Hernia belts actually complicate the case. So I would advise all the patients never to use a hernia belt. The best option is go to your surgeon and he will give you the best advice on how the hernia can be treated. Coming again, the complications, like any surgery involves a little multiple risks or complications which are calculable by the surgeon according to his expertise. So basic wound infections, if that can happen, will be treated by antibiotics. But rather than that, nothing much. You get operated, the next you're out. It's a very conventional surgery. But why this video? Because we are talking about inguinal hernias in females. So female hernia is rarely detectable, comes once in a lifetime, and you need to have an expertise on how to do a laparoscopic approach for an inguinal hernia in a female. So for more queries, you can email us or contact us at MASH. Thank you.